Let's talk about the two. So we've already talked about the lawyers who are not litigating on your behalf. We've talked about the internal appeals processes that always seem to go, again, in the insurance company's favor because they're trying to save in costs. We've talked about them not wanting to give you the right to take them to court by forcing you to go through arbitration. That's what the healthcare companies are doing right now in the private industry. But there's no rage about that. What does the government want to do? They want to give you a public option. They want to make sure that you can have no pre-existing conditions, so you're not the part of the 12 million people a year that you are discriminated against. They want to make sure that there's no discrimination in terms of your coverage and accepting you, and you won't be able to be part of those 14,000 people per day that's dropped from coverage. They want to also make sure that there's no limits on the amount of caps that your insurance that you can actually get in terms of your total claim. Did you understand that 62% of all of the bankruptcies last year are due to medical expenses? And so you might say to that, well, you know what? They should have got health care coverage. Well, guess what? 80% of all of the 62% of people who had medical expenses or medical expenses led bankruptcy, they had health care coverage. What happens is you reach that cap, and then the insurance company does not want to cover you anymore. That sounds like a death panel to me, but there is no outrage against that. There is no rage against that. This is a hypocrisy, but it only can be addressed by getting the information out there to you, the American people. The Institute of Medicine gave us the stat of 18,000 people die every single year. 18,000 people die every single year. You know, I was working on Wall Street, or a Wall Street firm, an equity firm, and it was in Jersey, and I saw the second plane hit the World Trade Center, killing 3,000 Americans. And you know what? I don't think there was a single person out there who didn't have a tear in their eye over that next week or so as we cried and we tried to all come together as a country, because 3,000 of our fellow American citizens were taken from us tragically. And that hurt. It still hurts. And there are people out there today who still suffer from this post-traumatic, this stress of what 9/11 did to them, whether they had family or relatives in there, or they were one of those individuals like myself who saw that plane hit a building. It enrages me so much now to even think about that image of a plane hitting that building, and 3,000 of my brothers, American brothers in this country, were taken from us. Well, you know what? That 3,000, you times that by 6. And then take that figure, times it by 6, and make it happen every single year. That's what the healthcare industry is doing to us. 18,000 people die every single year. That hurts just as much as me looking at that 3,000 individuals taken from us on that tragic day on September 11th. 18,000 people dying away every year. That's tragic. We need to do something about this. Healthcare reform is the only thing that we're going to do, but we have to be informed. We have to make sure that this information gets out there. And guess what? They're not just wackos out here spreading this information. They're not just people out here who are these individuals at these town hall meetings who you may feel may have a few screws loosed, or people you might see at these tea bag parties, or individuals out there who are essentially you feel that just don't have a few tools short of having a complete shed. You know, these are people who are prominent figures in our industry. Let's look at here on radio on July 16th, former Republican Lieutenant Governor of New York, Betsy McCaughey, said this: Congress would make it mandatory, still talking about death panels, that every 5 years people in Medicare have a required counseling session that will tell them how to end their life sooner. Okay? How to decline nutrition, how to decline being hydrated, how to go into hospice care. All to do what's in society's best interest and cut your life short. That's from the former Lieutenant Governor, Republican Lieutenant Governor. Let's talk about the House Republican leader, John Boehner, and Republican Policy Committee Chairman, Thaddeus McCotter. They made a joint statement. These are people in power right now today, saying this: Section 1233 of the House drafted legislation encourages healthcare providers to provide their Medicare patients with counseling on the use of artificially administered nutrition and hydration and other end-of-life treatments. And they may be placing you, and they may place seniors in situations where they feel pressured to sign end-of-life directives that they would not otherwise sign. And then they go on to say that this provision may start us down a treacherous path towards government-encouraged euthanasia if acted in law. These are people in Congress right now. And then, of course, you know the former governor of Alaska, Sarah Palin, who came out with the infamous death panel statements. Well, you know what? I teach financial literacy. That's a part of my job. Well, I'm also a part of the president of the Optimum Institute of Economic Empowerment, and we do 4 to 6 workshops a month all across this beautiful country. And one of the major things that we talk about is the importance of your estate plan. And in your estate plan, every one of you should have, all of you, old, young, and everybody else, a will, a living will, healthcare proxy, and a power of attorney. Well, guess what? Me teaching that is not teaching individuals of how to end their life sooner. It's just empowering them, giving them more information, making sure that if that tragic day ever happens where they're not able to make a decision for themselves, they can use their living will and healthcare proxy to have someone else give them a voice and make sure that their voice is being heard. This is not a measure to give the power to the doctor. This is a measure to make sure that if you're in a coma, in a vegetative state, and you can't talk, your doctor can speak on your behalf and make sure that your wishes are being heard. And for the simple fact that I don't know, and I'm not one to try to judge, I don't know if John Boehner or Sarah Palin or Thaddeus McConnell are just ignorant of these reasons, or they're just blatantly lying to try to make sure that you have a misrepresentation of the truth. I don't know. But whatever it is, it needs to stop, and we need to make sure that we have the right information. So I have with me some excerpts taken from the actual bill. Okay? I want to read you this part that starts on Bill H.R. 3200, which I've read the entire thing. It's 1,018 pages. Now, when people say 1,018 pages, they think, oh, wow, it's very long. You know, the correct term should be 1,018 paragraphs. Go online and look it up for yourself. I read the entire bill in less than a day. It's a paragraph on each page. It's not a whole lot of verbiage on it. It's not like reading a book. So it's not that long to read the bill. It took me about maybe 3 to 4 hours. I read the entire bill. I've actually read it a few times to try to make sure I've outlined and highlighted certain things to learn from it, to educate myself. So this 1,018 pages it's a misconception in itself. It's not as long as you would think. And you can read it for yourself, and I urge you to do so. But on page 425 in subsection HHH, where it discusses advanced care planning, it says, the term advanced care planning consultation means a consultation between the individual and a practitioner described regarding advanced care planning. It's subject to the paragraph, the individual involved has not had such consultation within the last 5 years. Let me tell you this. You need to make sure you are consistently talking to your doctor. Talking to your doctor, making sure they know exactly what your wishes are. All this bill is trying to say that when you do talk to your doctor, that consultation, not a consultation to try to have the doctor's wishes put upon you, but a consultation to make sure that you are communicating with your doctor what you want your wishes to be. God forbid if something should happen to you when you can't make your decision for yourself. This is an empowering conversation, and it is disgraceful and quite frankly an insult to those like myself who teach financial literacy to have individuals spreading these blatant lies to the American people. And we deserve better, especially out of our elected officials, Republican or Democrat.